Good morning. I'm Dr. Ben Dodd from Brisbane Upper GI, and today I want to talk to you about the process of weight loss surgery for patients and hopefully answer some of the questions that you may have about this process. We know that patients who find themselves overweight, largely as a consequence of our dysfunctional modern food environment, can feel disempowered and have reduced self-worth. So it's a very emotional issue for patients, and this applies to males and females who are mildly overweight to very overweight. It's a consistent pattern that people feel quite ashamed of being overweight, and society contributes to that certainly. So the biggest challenge probably, or certainly one of the biggest challenges of the weight loss surgery journey, is for patients to take that emotional plunge. And it's hard, psychologically hard to do, so I take my hat off to you for confronting and considering the need. But certainly that emotional plunge is a necessary step. So that's the first step. The second is to gather information, where you hopefully read some good sources on the internet, hopefully find many informative videos where you gain an understanding of what operations are available, what the process is before the surgery, around the time of the surgery and post-operatively, and also then not neglecting the necessity of the hard graft of psychological change to ensure that all of your weight comes off over the longer term and that you can keep it off in the longer term. There is a commitment involved to follow up for ideally 5 years. We're deliberately putting you into a malnourished state and keeping that safe by seeing a dietitian regularly, having regular blood tests and taking multivitamins, etc. So it's a commitment to a process. It's much more complicated than just getting a haircut, but it is a very, very safe process if it's done with an appropriate team of surgeons supported by a very good nursing staff, dietitian, psychology, etc. Once you've gathered the necessary information and made your plan, having discussed things with your surgeon, then you need to decide when to do this. This is a big life event. The surgery is extremely safe, but this does involve a commitment to accepting that if you want to become a lean person, then there is a degree of psychological change involved, and that's hard. And I think trying to do it at a time when there are less other things going on in your life, so you've got some time to focus on that difficult process of psychological change, lifestyle factor change. And then obviously which operation is an important consideration, which I'll talk about in other videos, and trying to think what must you do differently on the long-term basis and how you can subtly change your lifestyle processes, particularly eating, so that you can make subtle changes to get your weight trickling down over time to a healthy BMI of 25 or less. So once you've gathered this information and made some decisions about when and what type of surgery, it's a matter of actually proceeding with it on the day. So in the lead up to surgery, you invariably will see a dietitian, and that's for education about the expected post-op dietary changes, both in the short and the medium term, but it's also for most patients about going on to what's called a very low calorie diet, or VLCD, usually in the form of meal replacement shakes. And this is a difficult process and absolutely needs the input of our expert dietitians to ensure that it is safe. So the pre-op diet of between 2 and 4 weeks of VLCD. On the day of surgery, you'll come into the hospital fasted, usually quite early in the morning. Mostly we'll get you walking into theatre because this reduces all of your risks. The surgery itself is extremely safe. The expert anaesthetists that I work with give you modern anaesthetics with next to no, if not, and preferably no opiates. I myself use huge amounts of local anaesthetic in the skin as we're starting and inside the abdominal cavity. And because of these measures, most patients wake up with no pain and no nausea. This allows us to then allows us to practice what is called enhanced recovery after surgery, or ERAS. This is a very evidence-based concept that's been around for almost 30 years now. Very high levels of evidence supporting its not only safety but superiority in terms of reducing all complications. And this involves 3 main steps. We're basically trying to get you up out of bed and moving as normally as possible, as quickly as possible. We're aiming to have you eating and drinking normally, and to have you breathing as deeply as possible. So eating as normally as possible, breathing as normally as possible, and moving as normally as possible. And we aim to have this and achieve it for the vast majority of patients between 1 and 2 hours after surgery. So patients can expect to wake up with next to no pain, at worst some shoulder stiffness, soreness, some abdominal wall stiffness, like 50 sit-ups, but not pain. And that allows us to get patients sitting out of bed, drinking soups and water, and taking the drip out and getting them deep breathing and moving around very quickly. And this drops all complications: bleeding, staple line leaks, anastomotic leaks, leg clots and lung clots. All those risks drop substantially if we can encourage patients along this ERAS path. If patients are very good on day one, 95% of them are able to go home on paracetamol and perhaps 24 hours of anti-inflammatories. Patients are discharged with opiates, though they rarely need them. Coming soon, we will be doing day case gastric bypass and sleeve gastrectomy, mostly to facilitate uninsured patients accessing surgery to make it more cost effective. So please ask my reception staff about this option. So moving from the operative phase, we then move on to the diet recovery phase, and this is where the dietitians are particularly important. They will guide you back to solid foods, usually over a 5 to 6 week period, and this really is a concept of learning to eat again. It's quite restrictive through liquids, then purees, and soft food. You've got to recognise that your appetite's going to be very different. Your stomach's much smaller, whichever operation you have, and this does take some getting used to. Many patients are astonished how little appetite they have, and we want you to embrace that, but we also want you to focus on getting enough protein. So having one of our expert dietitians see you is very, very important. As patients come out through that 6 to 8 weeks post-operatively and they find they can eat more normal foods and they get used to their new stomach and their new appetite and interaction between the food environment and their brain and their stomach, we then move into the phase where patients are focusing on getting their weight loss outcome over time. And everything in life, people who win and lose at anything in life, no one starts out wanting to lose. So it's not the goal that separates them, it's the process leading up to that. And so focusing on that process of eating like a lean person, putting one foot in front of the other, and you're breaking it down. I think 90% of this is changing how we eat, but there's also other simple things like trying to restore our bodies back to the caveman origin that they were designed for. So I think more sleep, minimizing screen time and digital tech access, generally trying to increase our time spent outdoors in fresh air and sunlight, and absolutely trying to move more. But the biggest thing is trying to eat like a lean person. We can break that complex task down into what is calorie excess, as I said, that drives weight gain over time. You break that down from too much of the wrong food too often to becoming less of the right food less often. And it's not a big difference, but it's just making 1% differences here and there that over time, like compound interest in a bank account, adds up to very significant weight loss outcomes. So the final phase is basically me making you feel much more in control and empowering you to exist as a lean person in our modern obesity-provoking food environment. And so there are many malignant corporate interests that profit from patients and the general public thinking that they're not in control of their leanness and their eating habits. But I promise you it is, allowing for variations between different people's bodies. I promise you it is a calorie excess that drives weight excess, and you can argue the toss over different dietary subtypes, but at the end of the day, it's a decision to pay more attention to what we eat, to eat like a lean person, and to have that mantra every day and spend more time thinking about how you can eat and behave like a lean person. And that is the secret to becoming a lean person and keeping all that weight off forever. And it's not easy, I don't dispute that, but I promise you that you can do it. I have great faith in human resilience, and with the right tools and subtle changes, that is how you ensure that you will get all of your weight off to a BMI of 25 long term, if you so desire, and keep it off forever. Hopefully this has been informative, and I look forward to discussing with you in person and clarifying any questions you may have.